All right. Good morning, everyone. I'm very excited to be able to welcome everyone. I know that people are still joining, but just in the interest of kicking things off, I think it's good for us to start. So on behalf of the Mad Studies Hub at York University and the Canada Excellence Research Chair in Health Equity and Community Wellbeing at Toronto Metropolitan University, I'm delighted to welcome you to today's session. My name is Marina Morrow, and I'm a professor in the School of Health Policy and Management at York University, and I'm the director of the Mad Studies Hub. By way of visual description, I'm an older white woman with almost shoulder-length blonde hair. I'm wearing a cardigan that's sort of mixed colors of white and brown and black. And I'm very pleased today to introduce you to our presentation on novel sociological methods and practices of engagement across disability communities with our very special guests, Aimee Sinclair, Luke Beesley, and Danielle Landry. As you know, today's event, of course, is virtual, so people are joining us from online from across Canada and beyond. Just wanted to remind people that auto captioning is provided, but you just need to select the CC button on your Zoom menu bar in order to see the captions. If anybody's struggling with that, just send us a message in the chat, and we can support you to do that. Before we start the event, I wanted to offer a land acknowledgement. And since we're not all gathered in the same space, I invite you to reflect on the territory that you're on. So we acknowledge the land that we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it's now home, of course, to many diverse nations, Inuit and Métis peoples. We also acknowledge that Toronto, also known as Toronto, is covered by Treaty 13 with the Mississaugas of the Credit. I would like to pay my respects to elders past and present, acknowledging First Nations people's shared experience and impact of colonization on their health and well-being, their families, their kinship networks, and communities. We recognize the sovereignty of all Indigenous nations as the original inhabitants of these lands and waters, and we give thanks for the opportunity to work, live, and play on this land. So I'm going to just begin by telling you a little bit about the co-sponsors for this event. And you'll see on the screen there's a QR code that you can, if you've got your phone with you, you can click on it and you'll see a little bit more about each of the co-sponsors that I'm talking about. So to start with, I'm going to talk about the Canada Excellence Research Chair in Health Equity and Community Wellbeing, otherwise known as the CERC. The CERC is a transformative research initiative that employs an engaged community partnership approach to expand the understanding, practice, and delivery of health outcomes for all members of our community. Through a collaboration with a network of healthcare institutions, service providers, and civil society organizations, the program aims for a paradigm shift, one that challenges a siloed, expert-driven approach to health and well-being and moves instead towards a community-engaged preventative model of well-being. It uniquely applies a critical disability lens, and the research program aims not only to reduce health disparities that are inextricably linked to their social contexts, but to embed community knowledge into healthcare institutions, systems, and models of delivery. Since the beginning of the program in January 2024, the CERC has hosted numerous events, and they're planning for more later this year. So please check out their website, their social media for links to upcoming events. So the Mad Studies Hub, which is located at York University, brings together scholars and students across 5 faculties, and its membership has now grown externally to include over 50 additional scholars, students, advocates, and community-based mental health organizations, all of whom apply critical theoretical frameworks to mental health and work in collaboration with the Hub related to research, education, and knowledge mobilization that centers MAD lives and experiences. For those of you that might not know too much about MAD studies, it's a discipline that's grounded in the history and activism of people with lived experience of psychiatry and mental health systems. MAD studies presents a challenge to biomedically dominated mental health systems and unsettles how we think about concepts like mental health, mental illness, and normalcy. At its most powerful, MAD studies employs intersectional frameworks that recognize that privilege and oppression are overlapping and intersecting, And for more information and to learn about our upcoming events, make sure you check out the QR code and our website as well. So the co-sponsorship of this event by the CERC and Health Equity and Community Wellbeing and the Mad Studies Hub is actually very fitting. Both organizations actually started around the same time in 2024, but also because the work you're going to engage with today is about bringing together MAD praxis and disability justice and thinking about this through the lens of methodology. The event is designed as a masterclass, meaning that we will have some dedicated speakers. And then we have allocated some time for those of you who are listening in to discuss methodological questions that you bring from your own research experience. We ask that you hold on to your questions till the end of the presentation, but please feel free to use the question and answer box or the chat to comment or share some of your own methodological dilemmas. So now I'm very pleased to introduce our speakers for today, each of whom are going to speak for between 15 and 20 minutes. We have with us, not physically, but virtually, Aimee Sinclair, who's located in Australia. Aimee is a PhD candidate in the Faculty of Health Sciences at Curtin University. Aimee identifies as a mad sociologist and indicates that alternative frameworks of understanding her distress and alternative responses to her distress has saved her life on many occasions. As such, she is passionate about ensuring peer work continues to provide and advocate for alternatives to biomedical approaches. We also have with us Luke Beesley, who's a senior teaching associate in politics at the University of Manchester in Great Britain. He researches historical theories of disability oppression developed in activist movements and applies these to contemporary social and political conjunctures. He sits on the steering groups of the Marxist and Disability Network and the Disabilities People's Archive in Manchester. And then last but not least, Danielle Landry, who is a research associate with the CERC at Toronto Metropolitan University. She leads a stream of research on social determinants of health. She's trained as a sociologist and is interested in the meeting places between disability studies, MAD studies, and work and labor studies. As a PhD candidate in the graduate program in sociology at York University, her SSHRC-funded doctoral research focuses on the activist knowledge practices of psychiatric consumer survivor businesses in Ontario in the 80s, 90s, and early 2000s. She's also taught a variety of courses in MAD studies and disability studies at TMU. I just wanted to note for all of you that each of our speakers is a contributing author in the recent special issue of Frontiers in Sociology, entitled Novel Sociological Methods and Practices of Engagement Across Disability Communities. I really encourage you to take a look at that special edition if you haven't had a chance to. Danielle was one of the guest editors, and it encapsulates many of the conversations that we're going to have today. So each of our presenters are going to discuss their own research, offering reflections on what their methods reveal about the politics, practices, and possibilities of disability and MAD studies research. Just a note again that because of the time differences with Australia, Aimee's unable to be with us in person, but she's recorded her presentation, and we're going to start with Aimee's presentation first. So it'll just take a minute to get it up, and then we can all listen to it.
Hello, thank you for being here to hear a little bit about my work. My name is Aimee. I'm a PhD candidate at Curtin University, and in this presentation I'm going to talk to my article on MAD time within this special issue. And I'm going to think about MAD time as a disruptor to normative research politics and practices. I'm so honoured to be invited to be not only part of this event, but also have my own publications sit alongside so many other great publications in this special issue. If I'm completely honest, I nearly pulled out of this presentation for multiple reasons, but one of which was I'm quite intimidated to be speaking alongside so many other folks who are really great thinkers and doing some really great things in this space, particularly when I feel so, as I feel very early on in my own kind of research journey. This last month has also seen me taking on some extra caring responsibilities, which means I'm feeling very underprepared for this presentation. I really wanted to interweave my own thinking and my own writing in this article with the wonderful thinking and writing of others in this special issue. It just hasn't happened. I'm really trying to hold in mind, putting aside those ableist, colonial and neoliberal ideas about professionalism and labour that so many contributors to this special issue critiqued. And I'm trying to instead hold for myself, and I hope you will also hold for me, some radical compassion, acknowledging that our lives are messy and demanding and that we're all deserving of care. And for me, this is really kind of the point of this special issue. So I'm a white settler on the lands that I live and work, the lands of the Whadjuk Noongar people, and I acknowledge Whadjuk Noongar elders past and present for their historical and ongoing custodianship of this land. I also think it's really important when speaking about relational ways of existing and alternative ways of thinking about time, that it's important to acknowledge that in so-called Australia, Aboriginal and Torres Strait Islander folk have long lived and breathed alternative humanities and relational ontologies and relationships to time that are often excluded or co-opted within academia. I myself have had a part to play in this, and I'm desperately, although I'm sure maddening and slowly to some folks, trying to learn to do better. My own ways of thinking and practicing have been heavily influenced by MAD studies, and I have my own lived experiences of psychiatric oppression and navigating mental health systems, and I draw on this experience and the experiences and theorising of others with both similar and different experiences of psychiatric interactions in my work, acknowledging that whilst we're all in this together, we are not the same, and as Jackie Wang says, we are not equally fucked. My current research looks at the politics of inclusion, particularly in regards to peer support work and the Australian mental health system. And so it was through this research that I've become interested in MAD time and MAD methodologies as a way of thinking about and doing research that unsettles sanist and colonial practices within academia and beyond. And so this is what I wanted to explore today, and this is what my article explores: MAD methodologies and entanglements with time. I want to start with this quote from Paula. So Paula was a contributor to the research, and as part of this process, we came together in a workshop where we used images such as this image of a private inpatient facility, quite similar to that, to kind of those across Australia. And we also use reflective prompts to think about and feel through the relations within mental health assemblages that affect the way in which distress and care and peer support are enacted. So here Paul is talking about time. She says, sometimes you just want to have your curtains closed. I'm having this sort of memory of the darker days, of both internally, but also wanting a darker room for whatever reason. And then when people come in and just thrust open your blinds and just completely walk into your space because it's whatever time on their shift and decide for you that it's morning. So Paula, I think, is describing here, and we discussed in the workshop, a kind of temporal violence that individuals experience within mental health assemblages, where someone else decides what time of day it is for us and what we should be doing according to that time of day, where our own paces and our orientations to and understandings of time are often dismissed. So the first provocation I make within this article is that temporal violence is also carried out in the ways that we think about and do research. The second provocation I make in the article is that mad time as part of madness can be generative, that it can act as a disruptor to temporal violences enacted through methodology. So I'm interested in exploring what we might learn from mad time about doing research differently. So the concept of mad time is linked to mad studies, but it also has strong connections to queer, trans, and cripped time. And although folks outside of academia, mad folks, have been working with mad time and thinking about mad time, obviously for a long time, it's kind of conceptualization and writing about it in academic publications is less so. So here I'm really leaning on those who have gone before me in terms of thinking about mad time. For those of you who are unfamiliar, MAD studies is about centering the experiences of individuals who encounter psychiatric classification and violence, and it aims to both critique and transcend psychiatric logic and practices. So pushing us past this idea of madness as something that requires cure, treatment, or management, and instead encouraging us to think of its subversive potential. And here it's really important, I think, to not to romanticize madness. So we also need to acknowledge that madness can be incredibly distressing for folks, including myself. But I also want to think about how it can be productive and how we can value that productive nature of madness and mad time. So mad time can signify multiple and diverse ways of thinking, feeling, and doing time that coincide with experiences of madness and the material differences associated with those experiences or with being labelled as mad. So my thinking about mad time and methodology brings together a few different elements. So as I've mentioned, as a mad scholar myself, this has definitely informed my thinking and my practices. So that is my own experiences of my body-mind misfitting with normative temporal expectations with academia about when and at what pace research should be done. And there's been some great work done by scholars in this area, including those who have written in this special issue, thinking about cripped time and how disabled body minds can unsettle those normative temporalities within academia. I also draw on tensions that I experience trying to do research within academia that aligns with the values and practices of survivor research as an emancipatory practice, and expectations and systems within academia about what research should look like. And I know there's folks in this special issue that also talked about that struggle of trying to navigate academia whilst trying to do research that is anti-oppressive. So within, for me, without the framings to kind of conceptualize my own personal experiences, these tensions for a time went quite unspoken for me, pushed down as kind of something wrong with me not fitting within academia. And of course, for folks named MAD, this is quite common. We're often taught to distrust our own embodied kind of feelings and reactions, to dismiss them as unreasonable or irrational, rather than something as holding potential, something that can inform us and speaks to power. So luckily enough, when I started talking with fellow peer support workers as part of this research project, they really kind of prompted my thinking about, and our collective thinking about, temporalities and mad time. So during our discussions, time was an element that kept popping up in regards to peer support and their experiences within mental health systems. And this really provoked me to reflect deeper on my own experiences, but also the idea of mad time within research. So finally, I've also really been informed by the existing literature. And as I mentioned, work in the area of mad time is limited, but there's been such great thinking from cripped, queer and Indigenous scholars who all have theorised on non-normative aspects of time. My thinking has also been influenced by post-qualitative inquiry as well. So in the article, I talk about 3 ways in which I think mad time can be productive in disrupting normative research practices. And for the sake of time, I'm only going to talk to one of those today. So Rebecca, in our conversations, talked about clinicians only seeing people at one stage in their life. So clinicians taking a snapshot of someone's life, slicing and cutting time, assuming that this is representative of someone's life. We can also think about mental health interventions as being framed around the cutting of time. The before diagnosis and treatment and the after, when someone's deemed recovered, and I would critique that idea of being recovered, and therefore deemed suitable to return to normative roles in society. Time outside of mental health intervention can often not be imagined or comprehended in mental health spaces. And I would argue that this temporal cutting also happens within research practices. So research is commonly enacted as a linear, temporally bound process where what counts as data is defined around a cutting of time, before ethics is approved, before research proposals are written, before the data is collected. So events or effective forces that happen before or sometimes even during that inform our process and our practices and our findings are unspoken of. They're hidden from view. Such a framing assumes that there's a start and a middle and end to research and that knowledge can be discovered, captured and isolated. So we're encouraged as researchers to think only about the data collected through following that kind of set method and nothing outside of this data. And thinking with Mad Time has really encouraged me to think about data as deeply embodied and relational that necessitates a blurring of past, present and future. So what I write about as knowledge or outcomes from my own research isn't just about what has come from what might otherwise be labelled the data. Rather, I think from, through and against a variety of experiences, subjectivities, theories, temporalities that fold across the past, present and future. These multiple and diverse temporal relations inform what is produced. So, for example, I research and write as a queer feminist, as having cared for disabled body minds, as a mother, a community member, having a lifetime of moving through or not moving through the world as someone who experiences periodic debilitating distress, also as a facilitator of peer work training and supervision. And so I've been thinking and feeling about the implications of the research that I'm doing for many years with and in community before the formal structure of a research project. I've spoken with and listened to hundreds of folks with experience of peer support, all of which have informed my thinking. But these are excluded from the so-called data. What I would say is then the data that produce my thinking and feeling is so much more than what's written, for example, on an interview transcript. The knowing and effect generated is collective, created through relating cripply and madly. Mad Time, I argue, with its invitation to blur boundaries between past, present and future, prompts us to reconsider normative conceptualizations of what counts as data. It invites us to speak to and incorporate within our research approaches the messy overlapping nature of time and what occurs before, after and during data collection. Knowledge thus becomes reconceptualized as a product of assemblages of historical and ongoing socio-material relations, and data can be rethought as made, assembled and dynamic. And I would argue that in doing so, Mad Time aligns with post-qualitative and Indigenous scholarship that offers ways to think creatively and messily about what we consider data and how we work with it. So in the article, I also speak to how Mad Time challenges this idea of linear research following a set logical path. I'm not going to talk about this in detail, but in summary, I suggest that Mad Time invites us to let go of what we thought research should look like and what we thought it would become to allow for something new to emerge. So it wrenches us out of what is expected and allows for the unknown, for shifting ground. This really enables us to listen to what is emerging. I also consider how Mad Time provokes us to not only accommodate or to assimilate, but deeply value variations in pace within research. And for me, the Cripping Breath project, which I know has a publication in this special issue, provides some really excellent practical examples of this. So that brings me to the end of my very underprepared and unplanned presentation. And true to the idea of mad time, I haven't managed that well in terms of time, or I have, depending on how you look at it. But really, I'm hoping the article, however imperfect it may be, I hope that it supports others to think about and reimagine what counts as research and how we go about it in ways that may produce richer and more epistemically just knowledge for those deemed mad. If you would like to connect with me or chat further, you can occasionally find me on LinkedIn, where I occasionally share my mad rants, or that fancy little QR code there on the screen will take you to my ResearchGate page where all of my publications are available. Thank you so much, and I hope you enjoy the rest of the event.
Well, that was just it's unfortunate that Aimee's not with us, but I wanted to say I just really appreciate the way that Aimee introduced mad time to us, and the sort of the concept of disabled mad body minds and how that can really, disrupt academic time and academic temporalities. And I think in particular, her ability to kind of share how that can inform methodology, and how mad time can be productive, it can be generative, it's embodied, it's relational, right? So I think really appreciating those concepts, and I'm sure we'll have time to talk about them more. So I wanted to turn the floor over next to Luke Beesley for his presentation.
Thanks very much, Marina. I'll just give it a second for the slides to come on screen.
No worries. Take a minute for the slides. There we
are. And we're here. Fantastic. So good morning / good afternoon, everybody. My name is Luke, and today I'm going to be talking to you about emancipatory disability research, or EDR for short, which was an attempt to radically democratize disability research by decentralizing power to research participants or research subjects. This was developed in the early 1990s and blossomed, but very quickly fell into non-use. So we're going to try and figure out why that happened today and offer a hypothesis for that. So the names that you'll most commonly find associated with EDR are Colin Barnes, Mike Oliver, Jeff Mercer, and Mark Beesley. And they attempted to apply democratic theory to sociological research, basically saying that if we are researching your life, your marginalization, what have you, to disabled people, then you should have ultimate control over how the research runs. And they did this by handing effectively a veto to participants over each stage of research practice, from project design through to data collection, through to writing up and dissemination. And they did this either directly, i.e. the people who were participants in the project who gave their time to be interviewed or filled in surveys or what have you, had the chance to join a supervisory group, which was given that power, or they did so indirectly. Democratic organizations representing participants, whether those be disabled people's organizations or councils of a day centre or what have you, users councils, were given control over the project. EDR went through an incredibly intense period of growth and a very productive period of research from the mid-1990s to the early 2000s, but really dropped off kind of immediately afterwards. In a recent study, or recent-ish study of disability research, a number of scientists found that actually a very small amount of disability research involves any participant input whatsoever. I think it's something like 1 in 7 papers in English, German, or Spanish that they found had any design support from people who were researched. And actually only a tiny minority of those papers had the kind of input that you would expect from an EDR project. Could I have the next slide, please, Anita? Fantastic. So before we start talking about why this might be, why might EDR have fallen off of a cliff, I'm just going to outline the 6 principles which are supposed to govern it. Some of these are basically pleonasms; they're just repetitions of other principles in different kinds of words. So we won't spend a lot of time here. But for EDR to work, the people conducting research must commit, firstly, to using the social model of disability, or the claim that disabled people's disadvantage is socially caused and not biologically caused, as the theoretical basis of their research. Secondly, they must surrender any claim to objectivity in favor of reproducing participants and movement actors' self-understandings, normative values, and aspirations. Thirdly, they must focus their project's design around outcomes which would either bring practical material benefit to disabled people or would empower them to take that benefit for themselves by the removal of disabling barriers. Fourthly, EDR should devolve power over research planning and decision making to ensure maximal accountability to the disabled people whom it researches. Fifthly, the research should describe participants' personal experience without distortion, and it should represent that experience as part of a collective experience of oppression. And sixth, all research methods should be selected to reflect the preferences and priorities of the participants. Foreshadowing my conclusions a little, I have put principles 2, so surrendering the claim to objectivity, and principle 5, the description of personal experience of participants, in bold. These are the ones where I think we're going to find an explanation for why EDR was unable to survive into the new millennium, but I will get to that in due course. But please just bear those 2 in mind in particular. Next slide, please. So by the very late 90s, it was clear that the pace of research was slowing down dramatically, and by the 2000s, it had more or less disappeared. And so there were a number of explanations in the literature for why this was happening. Why were people no longer able to decentralize control over research practice to its subjects? I think each of these explanations is implausible, and I'm going to argue a different case shortly, but we'll go through them now. So firstly, academics who were often very heavily involved in this way of researching disabled communities, argued that actually everything had gone wrong because they had particular moral failings. So Mike Oliver, who came up with an early statement of EDR's principles, basically said that he thought that he and his colleagues had an unconscious bias towards hierarchies, them, the clever researchers at the top of the pile, the people they're researching who hadn't gone through advanced degrees, at the bottom, and that they had unintentionally self-sabotaged the projects through this unconscious bias, right? Other researchers similarly said, well, we suspect that maybe we were just too intimidated by our research subjects to really go whole in on this and make it work. I think this moral failing explanation is relatively weak, right? If the point of EDR is to decentralize power in research, then actually the moral failings of academics should be less important here than they are in any other research method. So this just on the face of it seems kind of implausible, sort of weak. The second explanation came from opponents, and it said, well, you go to disabled people and say that we want to give you power over a research project. Maybe actually they don't want that. And maybe they're suspicious of people who try to devolve power. Maybe they are much more comfortable thinking of academics as being the ones who know how research works and they just want to plug in and plug out. Again, I think this is a somewhat implausible explanation. If it is the case, as these scholars argue, that there's very little demand for control over research projects, then I think you have to explain why there was a very productive moment in the mid-90s where lots of research of this kind was possible. And then finally, some people who were involved in running EDR projects said that the problems was with the funders, right? Funders of disability research tend to be involved in large universities or large charities. Those are institutions that we know are not particularly welcoming to disabled people's input. It was suggested that they would distrust the participants of research projects and would not want to give them any power, and thus would refuse to fund democratic research. Again, I think this is implausible just from accounts we have of the funding environment in the mid-2000s. We have a number of papers where scholars reflect on their own practice, their own research design, and basically say that the funders they were dealing with were not interested in questions of research design. They were just interested in outputs. So it seems somewhat implausible that for this particular kind of research, there'll be a more adversarial relationship than there were for other research projects. Can I take the next slide, please? So I think actually we're thinking about EDR's failure in the wrong way. We are not recognizing what its strengths were and then trying to work back to find out what roles it didn't fulfill. And so I'm going to suggest here that EDR is actually a very good answer to a credible commitment problem in research. A credible commitment problem is something identified by political scientists and economists as a reason why engagement does not engagement between two parties does not arise or is prevented from occurring within different types of political, transactional, economic, or civil relationship. So I'm going to apply that here by starting with something that I think is probably uncontroversial to anyone involved in sociological research of any kind. If you want participants for a research study, you're going to have to incentivize them in some way to take part. And there are a number of kind of very well-trodden paths to get people to join you. So some people will be incentivized by being paid a small amount of money for their time. They will join your research project for that reason. Others will think that an establishment institution, a prestigious institution like a university, is just something they kind of want to be associated with for a while. And some people will think, you know, if science gets better, that's bound to benefit me in the long term. Many of these incentives don't actually work for people who are marginalized and oppressed. If I'm in an oppressed group, then I'm likely to distrust establishment institutions rather than want to be associated with them. If science advances, it may not actually benefit me that much. It may create new technologies which are very useful to other people but don't really impact my life. And if I'm on long-term benefits, long-term unemployed, then actually if you try to give me money, that's just going to give me a headache at the benefits office, basically. So how do academics respond to this situation? Their usual incentive structures are unable to capture the attention of people who are in oppressed groups. Well, they diversify their offering. That's the most sensible thing for them to do. So they throw a number of possible incentives into their research agreement with potential participants and hope that cumulatively these create an offer which is worth taking. So they might, for example, redesign their research so that it addresses the interests, real or perceived, of the oppressed or marginalized group that they want to work with. They might say, we are going to use methodologies which match your methods, which match your self-conceptions. Or they might say, we recognize that people from this oppressed group have these particular ethical concerns. We're going to try and build that into the way that the project is designed and run. Now, this is a very sensible thing for them to do, but it leads to a very real practical problem. The longer and more complicated a research agreement is, the harder it is to monitor and therefore the less credible it is. If we have something which is long and has a number of moving parts, there is no real way in which the participant can monitor the researcher's compliance with that. And everyone will be aware that it will be more vulnerable in case of unexpected events. A research design which has a number of commitments in it is just less able to smoothly adapt to changed circumstances than one that has fewer. So we end up with a pretty standard version of what a credible commitment problem is. The researcher, the research lead, the academic is incentivized to make a number of commitments at the beginning of the project, which they are going to be either unable or unwilling to fulfill at the end of the project. And therefore, the possible research participant is unlikely to engage with them because they do not know that the agreement that they're making with the researcher is actually going to last into the future. Next slide, please. Cool. So emancipatory disability research should actually solve this problem really, really well. If you hand over control over the research project to participants, then they can actually coerce the researcher to keep to the commitments the researcher made at the outset, right? They can say, we're not going to sign off on this research stage unless you do what you said you were going to do at the beginning, right? So they can jettison the whole thing. The researcher knows this, and they are therefore likely to make every effort they possibly can to match their commitments as they go through. So you should have a reinforcing virtuous circle, which gives both sides confidence to enter into an agreement with one another to run a project together. So we then have to say, if EDR failed, then it can't be something to do with its negotiating framework between the researcher and the research. That's probably the best possible answer we have to this question. It has to be something to do with the elements of its principles which are not to do with that direct agreement and the decentralization of power. Can I have the next slide, please? So this is my hypothesis based off of that insight, is that the sections of the principles of EDR that are not to do with researcher relations and negotiation are the ones which actually push potential participants away from the relationship. So as you remember from an earlier slide, EDR aims to faithfully represent disabled people's personal experience. That's principle 5. And to justify this, it rejects any claims to objectivity or scientificity. Let's presume that we're really interested in our personal experience being faithfully reproduced. The outputs of academic research are possibly the worst forums for doing that. An academic publication does not have very many readers. An academic workshop will not have very many attendees. And the way in which my personal experience is represented in those arenas is unlikely to be directly under my control. It must match the desires and demands of academic editors, the university funders of the event, so on and so forth. I also have a number of very low cost options open to me, which do a considerably better job. If I want to tell my story, talk about my personal experience, these days, of course, I can just go onto social media and do so. In the past, however, it's not particularly difficult to write a letter to the local newspaper, phone up the local radio station, and reach several hundreds, if not thousands, more people than the readership of an academic journal. If I'm in a marginalized group, I'm also likely to be interested in changing the world so that I'm not marginalized anymore. And that is much harder, and I don't have low-cost options available for me to do that. If I'm going to engage in practice or in a project to try and change the world, I'm likely to feel that I need a lot of information about how the world actually works to give me confidence that my strategy is not going to be useless or rebound on me or cause me more grief than it's worth. And things like objective research paradigms of the scientific method are likely to give me confidence that the knowledge I have is useful and can be relied upon. So the conclusion of this hypothesis is that EDR fails because actually it offers disabled participants something they don't need, a way to represent their personal experience already available to them elsewhere, and fails to offer them something they do need, which is confidence in research outputs such that they can use them in the world. Next slide, please. Fantastic. So I'm going to give 3 kinds of evidence for this hypothesis. So the first is that there is at least some portion of the disabled population who believes something very similar. And I'm taking this from a tradition associated with the Union of the Physically Impaired Against Segregation in the UK. They argued that disability research as it existed in the 1970s and 80s was mostly rubbish, and that was because universities are elite institutions and are invested in the status quo. And because they are elite institutions and invested in the status quo, their workers are incentivized not to find things in research which would challenge the nature of oppression, right? So there is an inability of academics in this account to actually grasp reality as it stands. Oppressed people, disabled people, queer people, people of color, and so on, actually don't have stakes in things continuing as they are. And as such, they are, quote, enabled to view reality objectively. The important thing is that their approach maintains a scientific analysis of our situation, which examines segregated institutions or other forms of oppression objectively within the context of modern social developments. So, look, close quote, and that's from Paul Hunt in 1981. So again, this group would agree that research subjects must control parts of the research, but this is precisely because objective analysis and scientificity is possible for the oppressed group, where it is not possible for academics. Next slide, please. My second piece of evidence is that actually where we see the most intense form of supervision from disabled people, whether as participants or in the or as democratic organizations, we actually find that they ask the researchers to ignore principles 2 and 5. So in cases where disabled people supervise a research project for longer than a year, and especially in cases where disabled people's organizations actually funded emancipatory research, we find that they tended to ask researchers to look at things which were objective rather than subjective and did not rely on personal experience. So these would include research into how much particular forms of disability policy cost. It would also cover research into the input factors for accessible house building and how public institutions adapt to new laws. And I've given some examples of those there. It is true that we do find long-term and disabled people organization funded forms of research which do look at personal experience, but often only in very particular circumstances. So, for example, there's a lot of personal experience reconstruction in one book-length piece of EDR from Mike Oliver, Jerry Zarb, and colleagues. It was funded by people with spinal injuries. However, it's clear that they were asked to do that kind of research simply because there was a vacuum of other forms of data. There was not background quantitative research on how many people accessed particular support services, how they engaged with them, and what kind of support they received. So that qualitative research asking people about their life experience was the only way available to fill in that gap. Next slide, please. My third piece of evidence is what I'm calling dogs that don't bark. So these are data points which are inconsistent with the other explanations, but are consistent with my hypothesis. So in the first instance, we have at least some evidence that the longer a research project looks at personal experience, the harder, the less engagement it gets from its lay supervisory team, right? So Gabbert and Seymour did a 15-month-long emancipatory project where participants' personal experience was used for interview coding and hypothesis development. And they found actually after the first 6 months, 4/5 of their participant supervisors were disengaged at any point. So the longer this goes on, the harder it is to maintain engagement on it. In this instance, nothing has changed with the funders. Nothing, it seems, has changed with the academics, but we still see participant withdrawal. And the second actually points in the opposite direction. There is a piece of transhumanist EDR conducted by Kirsty Lydiard, Dan Goodley, and some of their colleagues, which actually concluded that it had to claim that participants' personal experience was wrong. The participant supervisors' personal experience was wrong. People tend to see themselves as human beings, including these participants. The theoretical framework that Lydiard and Goodley use claimed that actually human beings don't exist and disabled people are some kind of assemblage transhuman concept. After they asserted this as a truth, the participants did not withdraw, which is what you would expect to happen if representing one's personal experience was something which was an uncomplicated good for engaging participants. Final slide, please. Cool. So I want to take some practical conclusions from this for future research. I mean, I personally believe there's a clear normative need to democratize research, and we should take advantage of the advantages that EDR offers in that regard. But to really exploit these advantages, we have to bring objectivity and the scientific method back into the core of our projects. We can't afford to reject them. And just to end on a note of intellectual humility that I think, everyone involved in academia needs to bear in mind. People's personal experience and their subjective reality are things that they already own, and we can't give them to them. If we want to take our participants seriously, we can't just try and reproduce their lives for our own professional circles. We need to aim higher, and we need to aim to give people information and data that they can be confident in and that they can put to use in the struggle to change marginalization and oppression, to do away with marginalization and oppression. Thanks very much. That's me.
Thank you so much, Luke. I'm just, I'm really, it's going to take me some time to absorb everything you've said, but I'm just really appreciating your detailed attention to EDR research and its failings, and particularly, I think, for pushing us to think about why this might be the case, and in a way, putting a challenge to researchers to think more deeply and complexly about why this is. So looking forward to more conversation on that. So I'd like now to invite Danielle Landry to give us her talk. Thank you.
Thanks so much, Marina. Can everyone hear me okay?
Yeah.
Yep. Okay, great. I'm just going to start with a visual description as well. So I am a middle-aged white woman. I've got medium-length brown hair. I'm wearing kind of a black and white sweater dress, and behind me is a white wall and a black and white painting. So I'm going to be speaking about the article I contributed to this special issue entitled "A Fight Worth Remembering: Sharing Archival Materials in Interviews to Support Recall of Ex-Mental Patient Activism." But first, I just want to say a few words about the special issue and the ebook that brings all of these works together. Next slide. So we put out the call for papers in 2024, and we were able to finalize and publish all of the articles by the end of 2025, and now that has become an ebook. When we were developing that initial call for papers and thinking through, like the editorial team was thinking through not only what we were trying to gather together, but how to represent that. Part of the process was we had to select an image, for that call for papers. And for anyone who's ever had to look through stock images of disability, you'll know they're generally terrible. So this really led to generative conversations about what kind of image we wanted to use to represent the special issue. And in the end, we selected this magnified image of a bone fracture, and we've used that for the cover of the ebook now as well. And we were, as an editorial team, we were really interested in this meeting place between medical sociology, disability studies, and the sociology of disability, as well as kind of the lasting fractures between those disciplines. And so really, that image is not used literally. We're not looking at bone science here, but that immediacy of a broken bone for us really recalled the efforts in broad fields like disability studies to center the body mind and to bring impairment into the frame alongside mobilizations against ableism. And for anyone who's read Skin, Tooth, and Bone, that's a disability justice primer written by a really foundational group called Sins Invalid. They refer to bone as kind of signaling the centrality of social movements, as backbones, as visionaries of cripped futures. And so we wanted to signal that important piece of text in disability justice. And it also alludes to breaking open the bone of mad grief. So it's kind of a reference in a mad studies text. But we wanted to signal that growing presence of mad studies as well as its own emerging field here. And lastly, this close-up image of a fractured bone really reminds us of our corporeality, and that connects us, as well as just the importance of scale and perspective when you're thinking through and framing social phenomena. So we've settled on this image, and we've used it as the cover for our ebook. And we were really amazed by the contributions that we received. Luke and Aimee both wrote articles in this special issue, and that there's many really great texts, and I would encourage you to use the QR code. Maybe if we have a chance, Anita, if you could put the link to the book in the chat at some point, that would be great. But there's essentially, we found there's a number of points of convergence across these texts. And there were kind of three major themes that stood out to us as they came in. So it was around disabled world making was one, communities of care for longstanding well-being was another. And lastly, this focus on novel research methods. And so this event was really intended to hone in on these innovative sociological research methods. And I just want to take a second to also thank the editorial team. So Temba Middleman, Hannah Morgan, Rebella Bay, and Catherine Soldatich for collaborating with me on this special issue, and to all of the contributors. We had 42 authors across 13 publications. So there's too many to name, but I just want to thank you all for your brilliant work. And again, just to remind everyone that this is a free open access publication. So please feel free to check it out and download the ebook. Next slide, please. So, sorry, I'm losing my voice a little bit, so I'll be sipping while I speak. But I'm going to be speaking about my dissertation research, as well as a digital archive that I'm currently building in partnership with Madness Canada as an extension of this work. And I'm really focusing primarily, again, on the methods that I engaged in this research process. But just to give you some sense of what the study was about, briefly, I'll just say it's a study of consumer survivor businesses. So in the 1980s, we had groups of current and former mental patients in Ontario that were successful in establishing a number of survivor-led initiatives, and that included survivor businesses. So these little small businesses are really akin to social enterprises, and they came to use this name, consumer survivor businesses, to indicate, what made them unique. And there were at least 25, as far as I can track, across Ontario. Really one of the central points I make in the dissertation is to assert that this early history of consumer survivor businesses in Ontario were sites of community organizing. So I'm really looking at that period from 1980 to 2005, when they were most active in their advocacy capacity. And in the presentation, you'll notice I use the words advocacy, activism, and community organizing somewhat interchangeably. And this is because it really reflects how people talked about those activities and what they do. Some people understood it in different ways, so I kind of use those words interchangeably still. These businesses were really distinct from earlier models of vocational rehabilitation or sheltered workshops or other forms of psychiatric service provider-led programming. And this is really because of their grassroots origins, their egalitarian approach, the way in which they compensated workers, which took into consideration things like benefits, and also the fact that they were survivor-led across the organization. So again, these are unique to Ontario. They were able to secure government funding in the 90s from the Ministry of Health, and they still have access to that funding. But it really, they were able to provide a limited number of accessible job opportunities for consumer survivors. My study really is focused on how, again, there's that circulation of activist knowledge practices, so how people learn and do community organizing within those sites. And I'm really interested in the formation of those businesses as sites of community organizing, because we don't really think about small business as a site of community organizing all that often. Next slide, please. So this study involved a creative application of Dorothy Smith's institutional ethnography. And I was running this, through the later years of the pandemic. So it was a creative application because it needed to be. I couldn't really go on site and speak to workers in the businesses in those early years. And so that really forms the methodological basis of this research. And again, it was a historic institutional ethnography. Now, so for anybody who's familiar with Dorothy Smith's work, she was a feminist sociologist, and her theorizing was heavily influenced by the women's movement and to a lesser extent, ex-mental patient organizing. I think a lot of people forget that her early writing was really steeped in this. So her texts, K is Mentally Ill, and the book, The Conceptual Practices of Power, A Feminist Sociology of Knowledge, really stand out as testament to feminist theorizing that challenged core sociological tenets, namely how objectified forms of knowledge get used to oppress women. In The Conceptual Practices of Power, Smith draws on her own experience of psychiatrization to brazenly challenge the fundamental tenets of psychiatry. And her work really stands as feminist sociological canon with respect to madness because it pushes back against women's psychiatric oppression. She used statistical and text-based analyses to demonstrate to researchers how they can flip questions that we ask so we can pay attention to how psychiatric practices operate and to understand how ruling relations determine women's experiences as psychiatric patients. These early publications really made bold arguments for understanding women's experiences of the psychiatric system as a political issue. And so for anybody who's not familiar with institutional ethnography, again, this is a methodology that Smith developed. It's a materialist approach, and it's positioned as an alternative sociology for people. So I think this pairs really nicely with Luke's talk in that it starts from research subjects' everyday night lives, but it actually extends beyond that experience. And it actually aims to discover how the world is socially organized so that you can change it. Here in IE, the social is located in how people's practices are coordinated translocally with the doings of others, right? What they do is coordinated through social relations. So research subjects are not objectified in the process, but rather standpoints serve as entry points for discovering and mapping social relations. It embraces a social ontology, and IE really has two main aims. First, is to explore and critique ruling relations in their institutional form, to enable people to orient their experience to where they want to go. And second, to build knowledge and methods of discovering ruling relations in contemporary society. So most institutional ethnographies, they're usually present-day studies, although there are some historical, i.e. research that exists, including a few that have combined oral history and some archival research methods. There are very few, at least so far, that are grounded in MAD studies, which this one is. And inquiries grounded in MAD studies are really, rooted in community and refuse apolitical understandings of history. And so this requires a meaningful engagement with MAD politics and praxis. And the study really aims to build on a longer lineage of community histories of MAD activism. Next slide, please. So for this study, my primary methods involved semi-structured qualitative interviews, and I worked with a wide range of archival materials, including a lot of activist ephemera. So in total, I interviewed 42 people using IE interviewing techniques, some people on multiple occasions. And these interviews were with people who started, who led, who worked in, who sat on the board of, or supported consumer survivor businesses in some way. So really were involved in those early years. And in the time that I have, I really want to talk about how I actually engaged archival materials in the interview process. So these weren't analyzed separately. I really brought the archival materials into dialogue in the interviews. And so I actually talked with people about them and brought them with me. And I'm arguing for this method's applicability more broadly across qualitative interview methods, beyond oral history, beyond institutional ethnography. But a lot of the literature is really just located solely in oral history and life history research. And I think it has a broader application. So these archival materials that were gathered were actually primarily from personal and business collections rather than formal archives. A lot of MAD history does not appear in the formal archives. I did gather some small amount from formal archives, but the majority was from people's personal collections and business collections. And so the study involved really large quantities of archival materials in a wide variety of formats. And I have a list on the slide of the kinds of the different formats that things came in, like films, radio interviews, photo albums, photographs, newspaper clippings, newsletters, like all kinds of stuff, all the kinds of material stuff of movement. And so part of the pre-interview consent process, I asked people if they had any materials that they would like to share as part of the research. And I was really taken aback by the generosity of community members who were willing to share all sorts of materials from their personal collections and consumer survivor business archives. And when they're viewed collectively, these materials really tell a story of activism, acts, big and small, by consumer survivors, and the important role that these businesses played as sites of community organizing. And I found that I inadvertently became the keeper of this archive through the process. And I recognized kind of through that process that it would be irresponsible of me to simply return those materials without anyone else ever seeing them collectively as an archive. And so that shifted my practice midway through doing this dissertation research. And when I was conducting the interviews, I'll just say that I did use an interview guide as well, but in many cases, the discussion also involved some form of engaging with archival materials. And those were really crafted around who the particular participant was. And participants were also given the option of using a pseudonym or using their real names. And I will say the vast majority chose to use their real names. I think that speaks to the fact that people who engage in kind of the collective organizing and activism don't often get the credit for the work that they've done, particularly in this movement. So my point here and in the article is really that archival materials can be beneficial tools to improve qualitative interviews. Next slide, please. So this is coming midway through the presentation, but I just want to situate myself in all of this to make a bit more sense of how I came into the research. So I identify as a MAD person, and I'm someone who's been involved in the MAD community in Toronto for nearly 2 decades now. So I come into it as a community member, but in other ways, I'm an outsider. Like I'm wearing my research hat in this role when I come into talking to people, and I've got no direct connection to consumer survivor businesses. Also the time and space of this, like in the 80s and 90s, I was the kid riding a bike in rural BC. I had no real sense, of what it was like to live through the Ray and Harris years in Ontario. And so I didn't experience that firsthand. So in some ways, I am an outsider to some of these experiences. And so I don't want to presume just because I'm a community member that I have a sense of this. But I do come into the work with an awareness of the community politics and knowledge of that activist history. But I was learning about, the role of these sites and getting a feel for what that time and space was like for consumer survivors then. And in terms of my process, I do want to speak about process here as well, because I think it's important to make these things visible. They aren't always talked about necessarily in research publications. And so I think my research practice, I'll say, has really been guided by a relational ethics of care and reciprocity. And I'll break down what I mean by that. So being guided by a relational ethics of care means I recognize how precious these materials are that people were sharing with me. And I really feel a responsibility to see this work through. And that really speaks, I think, also to what Luke was saying about, having commitments at the end of a project as well as at the beginning. So I felt that responsibility. And, one of these really surprise outcomes was this volume of archival materials that people were sharing with me was well beyond what I had imagined initially. And a recognition that if I did not preserve these scraps of paper, these loose photographs, these old cassette tapes in some way, so much of this would be lost and would never be shared publicly. And so part of this unanticipated work became co-curating this digital archive with consenting participants of consumer survivor business history. And this has been slow work. It has meant patchworking pots of funding together to make it happen in my non-existent spare time. And it has involved other people and partners. And that is completely external to my dissertation research in some ways. But I think it's really important to find a digital home for these materials and to preserve this collection as part of our collective history. And when and where I have consent from participants. And so that's what I mean by relational. It's not transactional. It's an ongoing dialogue and a constant reflection on ethical practices and treating those materials with care. As I said, Mad People's collective history rarely appears in formal archives, and these materials only exist because somebody cared enough to save them over the years. They recognize the value of these things, and I reciprocate with the same level of care and respect for those documents and things. And so that process has really determined how I proceed with tend to digitize only with permission and share materials. And I recognize the importance of these objects as really invested with significance by the people who share them. And this requires careful consideration throughout the data gathering, the interview process, and onto the creation of this digital archive. And also before each interview, I gave thought to who I was meeting with, which organization they had been affiliated with, if I had any materials that may be relevant to share with them. And so hand selecting the kinds of materials that might help that participant, reconnect with that time and space in the movement and be able to speak to that. It's part of that relationship building. It's part of just taking the time and care to do that. And I think we need to remember that all of our work, even as researchers, is really about relationship building. It's about the long term, not the short term outcomes. And when I say reciprocity, I'm thinking through an ethics of reciprocity here, which is arguably impossible to achieve in such a deeply inequitable world, right? But I'm aiming to create a mutually beneficial relationship and research practice. And so for anyone who shared materials with me, physical materials, when I returned them back, I also gave them back the digital formats so that they could use these and further engage with them. And so for instance, for organizations who have a limited capacity to preserve their own history or utilize materials from the past, having those digital copies was really beneficial. Next slide, please. So in this article, I provide 3 concrete examples and I story how I engage those documents with participants in a variety of ways. And I use different mediums, like I use photographs, I use text, I used even a video, like I played a video over a Zoom interview, and to what effect, right? And I talk about how that was largely guided by participant choices. And so how materials were shared or paired with interviews. And I'm kind of interested in talking through that and storying that in the article, because I want people to have a sense of how I kind of played with that. And I also include a story of how materials were gathered through the interview process and how that led me down a particular path. And it was more a dialogical kind of path, but I won't narrate those here. I do include a little picture in the top right-hand corner of some of the materials, just to give you a sense of kind of this assortment of stuff that I've acquired through the process. Really, I'm arguing that there are 6 benefits that I notice in doing this process, and of discussing activist materials or archival materials within qualitative interviews. So first, I found that bringing archival materials into view facilitated the gathering of more materials. So this is from people's personal and business collections. The more I shared with people, the more they thought about and remember what they had saved. And so many of these materials had been tucked away years ago, and people were like, oh yeah, I've got something I want to share. And so they would bring it out. And amidst the closures of businesses and the precarity of people's lives, a lot of these materials may never otherwise be shared publicly or preserved digitally. So I think this gathering of materials and remembering of stuff that matters is really important. Second, digital copies really offer rich possibilities for knowledge translation and mobilization, and activist possibilities as well here that go well beyond the limits of academic publishing, and they can foster new forms of public sociology. I will say, on my, again, non-existent spare time, I run the Instagram page for the Psychiatric Survivor Archives of Toronto. And I love seeing how jazzed people get about looking through the stuff of our history and our movement and making that visible for people. Not, academics, but like everyday people who just want to look through this material and learn about our history. So for me, I think there's a lot of possibility there in terms of how we can activate archives when we have digital copies. There's risks as well, don't get me wrong, but I think there is a lot of possibility there as well. A third benefit is accessibility. So as archival materials, they can serve as memory aids in an interview, particularly when you're discussing events from like 20, 30 years ago. For folks who are older, for folks who have memory issues, this can be super beneficial. But for all sorts of people who may, it's just beneficial to resituate yourself in a particular time and place, whether that's, watching a video or looking through old photographs, or, before you speak with somebody about events from your past. I think it can be really, really helpful. And so some participants were able to speak a lot more concretely. And again, I give examples in the article, but they gave more detail about their recollections when that material history was shared. And so it brought memories to the forefront. Fourth, I found that, it really breathed life to the story to have access to materials. When you have ethnographic narratives, to be able to make those more textured, more vibrant, more nuanced, and the interview itself will go further in depth when you have those materials you can lean into to illustrate examples. And that's not to say that people necessarily accept or agree with the texts, right? I think there's an engagement that happens when people start to remember that's really fascinating and really valuable. Fifth, participants can aid the researcher in making sense of materials by narrating a sequence of events or describing connections between seemingly disparate documents, or by pointing to particular examples of interest within a text. And lastly, the sixth benefit to historical research, where many people involved are no longer alive, is that these materials can be used to bring their contributions, their perspectives to light. And I write an example of this in the article as well. Now, certainly there are challenges to this process, and so I don't want to negate those either. The process led to a much more complex data collection and simply a larger volume of data than I originally anticipated. That's time consuming, and it requires gathering together people and resources, as I mentioned. But I think its benefits certainly outweigh those challenges. And there were certainly risks as well that were not fully anticipated. So for instance, I write about one example, how one participant, in looking through old photographs, was really struck by how few people were still alive from that particular photograph. And so those moments really bring grief and brought grief into the conversation. And so I think that's one of the challenges, certainly, that should be recognized. Next slide, please. And so the study really has brought up a lot of mad grief and mad joy for me in unexpected ways. And it's got me thinking more deeply about both of those. In the interest of time, I won't dwell on them here, but I can certainly talk to it more later if you'd like. But when engaging with mad communities, just know that those will be your traveling companions. And Anita, if you don't mind going to that earlier slide where I have all the businesses and the bubbles. Thank you. That's really helpful. One thing I want to point out here is the bubbles in gray. So there's some that are colorful and some that are gray. The ones that are colorful are the only ones that still remain, right? There's 8 of 25 businesses still remain. And so it's not just about these historical materials that are being at risk of being lost. It's really about the fight to keep consumer survivor organizations in operation and keeping them independent ongoing. And this is the fight now. And so being in community recognized means recognizing that fight and being a part of it, right? It's not apolitical. Being in community also means recognizing, respecting, and reflecting the diversity of positionalities and politics that people are coming from. So for instance, folks outside of the GTA don't use the same language to talk about their own experiences, and they don't talk about their work as activism. They talk about it maybe more as advocacy. So they don't use the same kind of language, and you need to respect and reflect that language that they choose throughout and understand where they're coming from. I will say there's a range of different political positions when it comes to the mental health system, certainly within the community. That's something I'm familiar with. But one thing I've recognized too is how the consumer phase of this movement really during that late 80s and 90s period is under-researched. It's overlooked often because it's considered to be less radical. But I think it's important that we work to understand people's positioning in a particular historical context and phase of that movement, and to understand why it became more entrepreneurial, why it had to evolve in particular ways. And lastly, I just want to point out that MAD community knowledges and histories belong to those communities. This was ingrained in me through mentorship and community involvement, and I think that's something I really want to hammer home here too. In closing, I just want to also say, there is a sociological significance to this collective remembering, preserving, and sharing of MAD activists' knowledges and histories in light of the precarity of MAD people's lives and the political economic systems that are eroding them. So how we go about this archival work really matters, and it needs to be done thoughtfully and with community engagement throughout. Institutional ethnographic methods really reminded me of the significance of documenting the complexity of everyday people's labors. And as MAD and disabled people, we're constantly improvising habitable worlds and lives for ourselves. So sociological studies that center madness and disability, they're really needed right now because they actually serve to expose and disrupt this normative order and unsettle the status quo in a really productive way. Okay, if you go to the final slide, Anita, I know I'm going over my time, sorry. I have my contact information there. I'm also on LinkedIn. You can find me with my name. If you have any questions or comments, please feel free to reach out. And I just want to thank you, Anita, for organizing and running today's event. And thank you, Marina, for moderating today's event as well and for partnering with the Mad Studies Hub. We really appreciate it. Thank you.
Thank you so much, Danielle. I'm just thank you first, for introducing us to the special issue and leaving us with that rich imagery of the bone fracture. And also thank you so much for presenting your very careful historical research on consumer survivor businesses and showing us kind of how the importance of history in the present and reminding us of the potential for community organizing, not just past but present. And I think there's a really interesting and nice kind of link between your work and Luke's work around, in a way, Luke, you set up the problem, and in a way, Danielle, I think you illustrated how to maybe do research in a way that speaks to that problem. So thank you so much for that. We do have some time for questions and comments, so I want to pause and let Anita read out any questions that might be coming in for our presenters.
Thank you, Marina. So the first question is, can you expand some more on Mad Joy?
Yeah, absolutely. Again, I'm still early to this. I'm still thinking about it a bit more, what that means in terms of our communities. But I was really taken back when I was looking through so many of these old photographs, like how joyful people were and how much fun they have. I mean, in a community that really struggles around social exclusion, isolation, coming together as a community, doing things together, like having a third space of some sort. Um, that is so valuable and so rich. And you could see through these kind of videos and photographs, like just this like kind of just, I don't know how to describe it, but like a joyfulness, right? And a real beauty to that. And also the ways in which, like in texts, even like old faxes, when people are faxing, jokes back to each other, this humor, and how survivors have always used humor as a form of resistance. And I think that is really beautiful too. So I think there's a lot to be said there, and I'm just starting to chew on those ideas. So I mean, I would love to hear from other people in the room too, maybe around how they see Mad Joy and what that looks like to them. I don't want to be the voice of authority on that, but I think it's something I'm certainly thinking about.
Other questions?
Okay, so next question from Elena. She says, thank you so much to everyone. This question is open to all panelists, but is directed at Danielle. In your work building this archive, what protocols of care for yourself as a mad researcher have you discovered or implemented?
That's a great question. And I don't think I've ever delineated or thought through exactly what the protocols are in terms of caring for myself. And maybe I should have done that more thoroughly. But I think a lot of it has to do with being patient with myself. This is slow work. This is a very long process, certainly, and shedding myself of ideas around what productivity looks like as an academic. And I think that's something that's constantly something I'm working through. And what, like you're supposed to have your degree done in X number of years and those types of things. I'm just kind of letting that go and shedding that because I know I'm doing it in a way that is follows that process and practices in the way that I feel is ethical and is right within community. That's more important to me. But certainly, as somebody who cares for a lot of other people too, not just myself, I think I would be thinking through that as one person within a kind of a group of people. I need to think through that a bit more and maybe write about that. So thank you for kind of provoking that.
Luke, do you have some thoughts on that as well?
Yeah, so I'm a qualified archivist, and I ran I managed the Disabled People's Archive before I went back into university teaching. And it's an incredibly good question. I think it's often assumed that, particularly actually by people working in academia, that archivism must be a kind of very nice, very relaxed job. And actually often it isn't, for some of the reasons that Danielle outlined. In terms of kind of self-care or self-management, the thing which I think helped for me was recognizing that just because you're the person who is recording this stuff now, that and it would have been lost otherwise, that doesn't mean that there's a pressure to do everything perfectly. There are real things that you should be thinking through. There are tough questions, and Danielle outlined a number of those. And you have commitments and obligations, right? You have to be doing this in as collaborative and as comradely a way as you possibly can with the people whose records you're preserving and who are still around. But actually, there's no way of getting that right, and that frees you up a little bit. If you go, this is never going to be perfect, I can't resolve in an archive the social problems which govern our world, then there's an opportunity to actually turn around and be honest to yourself, to the people you're working with, to your archive users, and say, look, there's only so much I can do. Here are our options. Where are we going with this? And actually taking that step, I think, is the most important one I took.
Thanks for that. I think we have time for another question. If there's one.
Yep, so this is our last and final question. This is regarding the ORE Institutional Ethics Review Board. This is from Charles. I'm a MAD and psychiatric survivor PhD student who utilizes autoethnographic research currently going through ethics. I hope to attempt to contribute to survivor-based research if I ever survive this PhD and use critical discourse analysis of institutionally documented archives of psychiatric incarceration, high school pushout into Toronto, and interview research methods. At what point does a university's ethics declare personal archives as quote-unquote data subsequently might be a sign the institutional overreach? Though traumatic, I have access to these documents now, such as Form 1's psychiatric discharge letters, date programs, and such. Did the institution ask you for examples of personal archives and what constituted as such? The main reason I am asking is, as MAD researchers who struggle against institutions, we are double wounded with having to provide quote-unquote proof, per se, within academia. Are there words of wisdom?
First, I'll just say hi, Charles. It's good to see you. Good to know you're here. I'd be happy to talk to you about this and working through this because again, I've done REB through York, and I'm sure Marina could also provide some guidance here as well if need be. Just so that I'm fully understanding the question, is the dilemma around how they're framing those texts as data, or is it around the fact that they're asking you to supply an example? I think what somebody refers to something as is less harmful, perhaps, but I just want to make sure, are they asking you to provide some of your personal health information? Because I think there is certainly room for pushback there. Because I mean, you could send them a redacted document that's all blacked out, because certainly that's a new practice in the world. But I think, that's certainly something I would be concerned about if they're asking for those examples, because again, it's not something that should be made public, even if you are working with that as your data. I think some of the text that I was using, it would be a lot easier to provide an example. So for instance, if I was, sharing a film that was, made public, like a fully published documentary, or if I was sharing some of these other policy texts that I was looking through, it's very different than if I was looking at health records and I was not looking at anyone's health records. So I just want to make that really clear. But certainly, I think that's something that might generate more conversation. I'm not an archivist, so this is also why things have taken a bit longer. I have had to learn a lot about archival practices and what that looks like specifically for community archives. And so that's new to me, and I'd certainly love to talk to you more about that, Luke, so that I could learn more too. But I'd love to hear any insights that maybe Marina, you have, or Luke, around this kind of dilemma. And maybe I'm not fully understanding it. But.
Luke, do you have anything you want to add there?
I'm aware that I'm working in an ethics system on a completely different continent. And so I worry that anything I say might be misleading, because I think the British system works in a very different way. Just really to say good luck, Charles. And I am still shocked by the behavior of ethics boards everywhere, where they tell us if we happen to be mad or crips or working class or of color, that actually, we're too vulnerable to own our own stuff and know what to do with it. So solidarity from across the pond.
Thanks for that. Yeah, so Charles, it would be good to engage in more conversation, maybe offline, around this, just to make sure we have the details correct. But I agree with Danielle that, certainly there could be pushback if they're asking for examples. I don't think that would be appropriate at all. And I haven't, it would be interesting to know what the context is to answer more fully. But thank you for the question, really important. So we're kind of at the end of our time, and I'm a bit sad because I think there's just so much more to say on this, and I really want to thank Aimee, of course, who's not here, but Luke and Danielle, for just such an interesting and generative conversation, and I think for really, both exploring kind of in the broad sense, some of the big kinds of dilemmas around emancipatory research, and putting the emphasis not away from lived experience, but putting the emphasis back on, what are the changes we want to make in the world and what does that look like? And Danielle, for your contributions really of showing how that can be done in a project that's, starts out as a historical project that has such important links to current day activism and to the continuity of psych survivor mad movements, right? So wonderful discussion. And we didn't really have time to get into Aimee's concept of mad time, but it was sort of ticking in my brain throughout the conversation. I think such an important thing to expand on and think about in our research. And just want to thank all the participants for taking time out of your day to join us. I really want to thank Anita for doing all the behind the scenes work on this event, and the CERC and the Mad Studies Hub. So thanks everyone. Have a wonderful day wherever you are.